10 minutes ago, I thought I would know the names of people, at least half of the people here. Now it's better, it's getting crowded. I'm an orthopedic surgeon, but I do spine surgery, and as you may or may not know, my sons are here. One of my sons have graduated from here, and again is my son. So I gave this talk in the professional day in 2010. Why go to medical school? Obviously, this is going to be a talk on medicine, and this is one of my slides at that time. It says, "What does it take to be a good doctor?" And my suggestion at that time was that it takes stamina, physical and mental stamina. It takes a huge ability to empathize and self-confidence, and I had cut it at that point, at that time. Now, in the 4 years that have passed since, I have learned some things as well, and now I tend to think that it takes an ability to make complex decisions as well, and this is what I'm going to be talking about today. Obviously, not obviously, but interestingly, at that time when I gave that talk in that professional day, I was never invited for a professional talk again, because my son, who graduated at that time, said that I actually scared his friends that would go to medical school. But now this year, I'm assuming that I can probably be invited again. So it's not going to be not too many technical jargon, but we need some technical jargon here. This is a spine. Spine is the backbone that connects our skull to our pelvis and hips. So we need it. Without it, we cannot survive. We cannot stand erect. This is a crooked spine, and this is part of my job. We see these crooked spines. This is called scoliosis. As you can see, there is a crookedness here. We see these in about 1 girl in 100 or so. So it's a fairly common disease. Now, what to do in these cases? This is part of my job. When I ask somebody what can be done here, well, if you're not an orthopedic surgeon or if you're not a spine surgeon, it's fairly difficult to think about it. And then I have to give you the options. And the options here are that we can leave this patient as she is. Okay, your spine is crooked, but you're alive, so you can just live like this. We can do some physical therapy or something like that, so that she feels better, she probably functions better. Or we can do surgery and correct the deformity. And this is not a disease that is specific to young girls. This can happen in elderly ladies as well. As you can see, this elderly lady not only has this curve, but he is falling forward, and she cannot stand erect by her own. So what should we do here is pretty much the same. Now, don't think that I'm going to ask you about what should be done here. These are just I'm talking about the options. So we can do surgery and correct the deformity. And in fact, we can do surgery and correct the deformity. This is the 14-year-old girl operated on, as you see, some very heavy metal work inside her. And then this is the elderly lady, again, some fairly heavy metal work. And then she was standing, she was just being able to stand like this. Now she can stand erect. So this can be done. But life is never as easy as this. This is a mechanical dock that was manufactured, I believe, by a French guy called Jacques de Vaucanson. And this dock, when you feed it, actually could take the grains, process them in a mill inside like this, and then just excrete them as a poo. And interestingly, this was a revolutionary idea at that time. But if you think that doing that type of surgery is the solution to all our problems, it is pretty much like thinking that this mechanical dock is fairly akin to a real dock. So life is not about what you can do, but it's more about what should be done or what you should do. So I just want to emphasize the difference between what can be done and what needs to be done, or what should be done. There may be what should be done may be different than what can be done. In which ways? Well, as a doctor, for a given treatment, we have to consider and find answers to these questions. What are the anticipated results? I can correct your spine, but then what's going to happen? What is it going to change in your life? What are the risks that are involved? So is it foolproof 100% that I'm going to get better with this treatment? What are the chances for these risks? Like if I'm going to get paralyzed or if I'm going to get wound infection, what are the chances for it? Then is it worth actually to take these chances? And what is the chance of a catastrophe? What happens if I get a catastrophe, and is there a chance for a catastrophe? And interestingly, when I see patients obviously, when I see patients, I tend to realize that my patients do not follow this line of thought that I follow when I examine them or talk to them. So I'm just going to emphasize this a bit as well. Now, talking about risks, your risks and my risks may be fairly different. Or your risks, your perception of risks and my perception of risks may be fairly different as well. So to what extent would you like to take risks in a given situation? Like, is there going to be a lot of pain if I have surgery for my back? Is this a life-threatening condition if I have surgery? Or if I do not have surgery, is my life going to be threatened for this? And should I take surgery if I do not like my body? Like, if I do not like my back, would you operate on me? If I do not like my nose, would you operate on me? If I do not like my breasts, would you operate on me? Is this justified? Now, this may sound something very philosophical, but it may not as well be that philosophical. The risks. This is a study that actually, we call this a visual scale. As you can see, you see these in the real life. These are 1 centimeter increments, as you can see there, so 0 to 10. And we ask you a question, what do you feel about this? And you just put a dot on that line. If you completely agree, you put 10. If you do not agree, you put 0. So we asked, this is a study not by me, but from literature. They have asked people, patients and surgeons, about possible complications of surgery. And as you can see here, the gray lines are patients, the dark gray lines are surgeons. And as you can see here, for almost everything, severity, quality of life, patient satisfaction, patient's perception of problems, and doctor's perception of problems were very, very different. Now, this is a study we did, me and my friends. These are all spine surgeons. Again, the same utility scale, but this time between 0 and 1 instead of between 0 and 10. And as you can see, these two lines denote two Spanish, in fact Catalan, spine surgeons. And as you can see, this guy didn't see any problem in due to most of the complications, whereas this guy saw deep problems. Why does this happen? We do not understand this. We still do not understand this. But it may be actually related to decision making in general. This is a fairly new book. It was a bestseller. Daniel Kahneman is a psychologist, and he actually got a Nobel Prize in, I think, 2010 or 2009 on how we decide. And he suggests that there are two methods of decision that we take. One is fast thinking. It is intuitive. Somebody asks us a question, we just say the answer. This is fast thinking. The other is slow thinking, and then you think, consider the data you have, and then give the answer according to this data. And evidence suggests that the less you know on a subject, you should probably revert to slow thinking. So if you don't know anything about a subject that you're asked about, do not answer very fast. It's the same with decision making in medicine. This is something interesting, but he's a psychologist, but his work was furthered by some physiologists. Physiologists, they examine the functioning of the body, and they actually found out that these two, fast thinking and slow thinking processes, come from different parts of the brain. One is the fast thinking part. The slow thinking part comes from where we have somewhere here, it's called the prefrontal cortex, and the second one comes from the limbic system. As you can see, the limbic system is here. The difference between these, again, not medical jargon, the difference between these is that this part is present in all mammals. This part is present in all vertebrates, like the reptiles have it as well. But this part is actually only present, this part is actually only present in primates. So by evolution, in years and years, we have actually achieved this functioning of our brain that gave us this sort of decision making. But then again, this is not flawless as well. The flaw is that our prefrontal cortex cannot process more than 4 bits of data at any given time. So what to do then? This is called, it's very confusing, but this is called a decision evidence-based thinking. If you are not sure how to respond to a question, ask for evidence. This is what I was talking to you about. Ask yourself or your doctor 2 questions. What are my chances of being better if I do not get any treatment? And then, what are my chances of getting better if I do get the treatment? And then, second level of questions, if I have this type of treatment or that type of treatment, and so forth. So, in the past, medicine was fairly easy. You got ill, and you went to a doctor, the doctor treated you. Now, medicine is getting very, very complex, and when you go to a doctor, you're not necessarily very, very ill, and you may have to consider these as well. Now this is a video that I like very much. It's from YouTube, and it was developed as a promotional video originally. It is a video of a day in Africa. Obviously, you can see. We can probably stop here. Stop. Okay. So now you see, this is a cheetah. This is a gazelle. Now think of the cheetah as a disease that you have, and the gazelle as you. So what is going to happen here? What are the students? What's going to happen here? And what are the chances for that? Pretty high, yes. But this is what we call evidence. Evidence says that it's about 30%. About 1/3 of any of these launches actually result in a kill. Well, kill of you, obviously. Here, you are the gazelle. So you're lucky. You have a 70% chance of actually getting away with it. Okay, so can we go ahead with the video? Now comes the doctor, as you can see here, and saves you. Now, this is the first part is called the natural history of the disease. The second part is the part that the doctor intervenes. Okay, so when you ask for medical treatment, think of your chances. I'm going to get 70% better if I do not get any treatment, and is it far more likelier for the doctor to save me from the cheetah like this if I do rely on the doctor? Thank you.